Hello, my name is Brittany. I'll be the student nurse practitioner today, and I'm here to do a head-to-toe assessment. It is Tuesday, August 24th, 2021. It is 7:30. I'm going to go ahead and scan my camera woman, and as well as scan the room. Okay, first I'm going to go ahead and assess the skin over his entire body, including his face, head, neck, anterior and posterior, chest, abdomen, upper and lower extremities for color, texture, turgor, edema, scarring, bruising, lesions, or any erythema. I'm going to go ahead and assess his head. It is symmetrical, it is midline, it is appropriate in size. I'm going to palpate his scalp for any signs of any indentions or infestations or any masses or lesions. I'm going to assess his hair. It is thick and black and silky in texture, and it is evenly distributed. I'm going to go ahead and palpate his temporal arteries for any pain or tenderness, as well as his lymph nodes for any pain or tenderness, his preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular for any pain or tenderness. Next, I'm going to go ahead and assess cranial nerve number 5 by going ahead and palpating his masseter muscle for any pain or tenderness, as well as having him open his mouth and clenching down his jaws, assessing for any pain or tenderness, as well as any signs of crepitus. I'm going to go ahead and have the patient close his eyes and assess for light sensation of touch. So when you feel my cotton ball, just let me know when you feel it. So close your eyes.
Feel it, feel it, feel it, feel it, feel it.
Okay, I'm going to go ahead and assess cranial nerve number 7. So go ahead and smile for me. Frown. Puff out your cheeks. Pucker your lips. Okay, I'm going to go ahead and palpate his frontal sinuses for any pain or tenderness, as well as his maxillary sinuses for any pain or tenderness. I'm going to go ahead and assess his external ears for any signs of any erythema or drainage. I'm going to palpate the pinna as well as the tragus for any signs of pain or tenderness. I'm going to go ahead and assess his internal ears for any signs of erythema or any signs of infection, as well as the tympanic membrane, and it's shiny, pearl-gray in color, translucent, and the light reflex is present, as well as assess his other internal ear for any signs of erythema or drainage. The tympanic membrane is shiny, translucent, pearl gray in color, and the light reflex is present. I'm going to go ahead and assess cranial nerve number 8 by performing a series of 3 tests. I'm going to stand behind the patient and go ahead and occlude your right ear, and I'm going to whisper 3 phrases.
Chicken, barbecue, salad.
Okay, occlude your left ear. I'm going to whisper 3 phrases.
Chicken, barbecue, salad.
Okay, and next I'm going to go ahead and perform the Weber test by taking my tuning fork and placing it in the center of the patient's head. Are you able to hear the sound equally on both sides?
Yes.
Okay, I'm going to perform the Renin test by taking my tuning fork and placing it on his mastoid bone, and then in front of his ear. Are you able to hear the sound on your greater on your mastoid bone or in front of your ear?
In front.
Okay. Do the other side on his mastoid bone or in front of your ear. Are you able to hear the sound greater in front of your ear or your mastoid bone?
In front of my ear.
Okay. Next, I am going to go ahead and assess his eyebrows. His eyebrows are evenly distributed. There's no signs of any scaling or fissures. His eyelashes are evenly distributed. No signs of any scaling or fissures. His conjunctiva is clear. His sclera is white. There's no signs of any discharge. I'm going to pull down on the lower lid. It is moist and pink. No signs of any discharge. I'm going to go ahead and assess for for the red reflex. Okay. As well as all other internal eye structures. And I would dim the lights with that as well. Next, I'm going to go ahead and assess cranial nerve number 2 by having the patient read my handheld Snellen chart. So go ahead and read the lowest line for me.
91573.
Cover your right eye and read the lowest line.
91573.
And cover your left eye and read the lowest line.
91573.
Okay, and now I'm going to go ahead and assess cranial nerve number 3, 4, and 6. At this time, I would dim the lights, and I'm going to assess for pupillary constriction. Remove your glasses for a second, sir. Just keep your eyes open. Okay, and so go ahead and you can place your glasses back on. I want you to stare off in the gaze and just follow my pen light. And then also follow my pen light. Checking for the 6 cardinal fields of gaze. There's no signs of any nystagmatism. Next, I'm going to go ahead and assess cranial nerve number 1 by having the patient close his eyes and smell this substance.
Garlic.
Okay. I'm going to go ahead and assess his nose. His nose, it is midline. There's no signs of septal deviation or any nasal drainage. I'm going to inspect his internal nerves. There's no signs of any drainage or any erythema. There's no signs of swelling of his turbinates. And I'm going to go ahead and assess for nasal patency by having the patient occlude his right nostril, breathe in and out. Occlude his left nostril, breathe in and out. Okay, perfect. Now I'm going to go ahead and assess the patient's lips. His lips are moist and pink. There's no signs of any lesions or cracking. I'm going to have the patient open his mouth. I'm going to assess his teeth. There's no signs of any missing teeth or any broken teeth. I'm going to assess his buccal mucosa, his tongue, his gum, his soft palate, hard palate, posterior pharynx. For any lesions, erythema, or exudate, his tonsils are a +2 on the grading scale. And there's no signs of any exudate. I'm going to assess for cranial nerves number 9 and 10 by having the patient stick out his tongue and say, ah.
Ah.
Okay, his uvula raises symmetrically with his soft palate and is symmetrical. I'm going to go ahead and as well as assess for cranial nerve number 12 by having the patient stick his tongue out, and then there's no signs of any tremor. Next, I'm going to go ahead and assess the patient's neck. There's no signs of any bruising, erythema, or lesions. I'm going to palpate the trachea. There's no signs of any deviation, as well as palpate his thyroid. Go ahead and turn to the left and swallow, and turn to the right and swallow. There's no signs of any enlargement. I'm going to palpate his carotid artery, +2, and as well as listen for any bruits of his carotid artery. And then I'm going to assess for cranial nerve number 11 by pressing down resistance on his shoulders and push up. And then I'm going to assess for range of motion of your neck. So go ahead and look down for me, and then look up, and then look to the left, and then look to the right. Okay, I'm going to go ahead and assess for any signs of respiratory distress or use of accessory muscles. I'm going to go ahead and come to his posterior chest, ma'am, and then assess. Can you remove your shirt, sir? Assess for symmetrical chest expansion. Deep breath. And as well as tactile firmity. So every time you feel my hand, say 99.
99, 99, 99, 99.
Okay, as well as percussing his lung fields. And while I'm back here, I'm going to go ahead and assess for CVA tenderness. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Okay, now I'm going to go ahead and auscultate in all of his lung fields. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. Now I'm going to go ahead and perform bronchophony. So every time you feel my stethoscope, say 99.
99, 99, 99, 99, 99, 99.
Now I'm going to go ahead and perform echophony. So every time you feel my stethoscope, say E.
E, 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 E.
Now I'm going to go ahead and perform whisper pictorically. So every time you hear my feel my stethoscope, whisper 99. Okay, now I'm going to come around to his anterior chest and go ahead and assess for symmetrical chest expansion and tactile firmity. So every time you feel my hand, say 99.
99, 99, 99.
Okay, and then I'm going to auscultate in his anterior chest lung fields. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. Now I'm going to go ahead and listen to his heart sounds in all 5 locations with the diaphragm and the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I would also listen to his apical pulse for a full minute, regular rate and rhythm, as well as palpate, identify and palpate for the PMI. Okay, and then I'm gonna have the patient lay supine. I'm gonna have you turn to a 45-degree angle and assess for any signs of JVD. There's no signs of any JVD, as well as assess for any signs of any heaves or any lifts, and palpate for any thrills, and as well as listen to his heart sounds in all 5 locations with the diaphragm and the valve. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, now I'm going to go ahead and assess his abdomen for any signs of any scarring, bruising, or nevi. I'm going to go ahead and auscultate his aortic artery for any B.Woods, as well as his iliac arteries, as well as his renal arteries, and as well as his femoral arteries, and as well as auscultate for bowel sounds in all 4 quadrants, as well as percuss in all 4 quadrants for Tiffany and dullness, and as well as do a light palpation in all 4 quadrants for any pain or tenderness or any masses, and then a deep palpation for any pain or tenderness or any masses. And I'm going to palpate for the liver as well as the spleen. Okay, I'm going to have you sit up, sir. I'm going to now go ahead and assess his hands and his wrists for any signs of swelling or any deformities. I'm going to palpate his joints for any pain or tenderness or any signs of any crepitus. I'm going to palpate his wrists for any signs of deformities or any signs of any signs of pain or tenderness or crepitus. I'm going to assess his capillary refill. It's -2. I'm going to assess his radial pulses, +2 bilaterally, and then I'm going to go ahead and assess his hand strength. So pull me toward you, okay? And then I'm going to assess the range of motion of his fingers. So just go ahead and wiggle your fingers for me, spread them out, put them together, make a fist, unball your fist, and then I'm going to assess the range of motion of his wrist. So put your wrist down, and then up, and to the left, and to the right, and then in a circle. Okay, I'm going to assess his elbows for any signs of swelling or deformities. I'm going to palpate his elbows for any pain or tenderness or signs of crepitus. I'm going to go ahead and assess the range of motion of his elbows. So just go ahead and flex for me, and then extend, and then hyperextend. Okay, and then I'm going to go ahead and assess his shoulders for any signs of any deformities or swelling. I'm going to palpate his shoulders for any pain or tenderness or crepitus, and then I'm going to assess the range of motion of his shoulders. So lift your hands up, and then down, and then to the left, and then to the right, and then take your right hand and scratch your back, and take your left hand and scratch your back. Okay, perfect. Next, I'm going to assess for cerebral coordination by having the patient close his eyes. Not close his eyes, take his fingers and touch the thumb with each finger, and then do it backwards. Okay, and then take your hands and flip them upside down on your thighs and gradually pick up speed. Okay, now take your index finger and touch my finger, then touch your nose, and touch my finger, then touch your nose, and then I'm going to have the patient close his eyes. I'm going to perform graphesthesia. Hold your hand out. I'm going to write something in your hand. You tell me what it is.
Number 3.
Okay, I'm going to perform stereogenesis by having the patient close his eyes. I'm going to put an object in your hand. You just let me know what it is.
Chapstick.
Okay. Next, I'm going to go ahead and have the patient close his eyes and assess for light sensation of touch of his upper and lower extremities. So let me know when you feel my touch.
I feel it, 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 feel it.
Okay, next I'm going to go ahead and assess the strength of his triceps and his biceps. So just push up against resistance of your bicep and your tricep. Okay, bicep and then your tricep. Okay, next I'm going to assess his deep tendon reflexes of his brachioradialis. well as his bicep and his tricep. Okay, of his patella. Scoot back a little bit for me. Okay, thank you. And of his Achilles. Okay, next I'm going to go ahead and assess for his Babinski. This reflex should be absent. Okay, I'm going to go ahead and assess his toes and his ankles for any signs of any deformities or any swelling. I'm going to palpate his toes for any erythema, for any pain or tenderness or signs of crepitus. I'm going to palpate his ankles for any pain or tenderness or signs of crepitus. I'm going to assess the range of motion of his toes. Wiggle your toes for me, and then spread them out, and then scrunch them up, and then unscrunch them. Okay, and I'm going to assess the range of motion of his ankles. So put your ankles down, and then up, and then to the left, and then to the right, and then in a circle for me. And I'm going to assess the range of motion of his ankles. Press down on the pedal, and then press up. And then I'm going to assess his capillary refill of his toes. It's less than 2. And assess his pedal pulses, +2 bilaterally, and his tibial pulses, +2 bilaterally. I'm going to assess his knees. There's no signs of any swelling or deformities. I'm going to palpate his knees for any signs of crepitus or any pain or tenderness. I'm going to assess the strength of his knees. Press up against resistance, and then press down, and then press up, and then press down. I'm going to assess the range of, the strength of his hips. So adduct against resistance, abduct, adduct, and abduct. Okay, I'm going to have the patient stand up. I'm going to go ahead and assess the range of motion of his knees. So lift your left knee, and then right knee, and then hold it your right knee back, and then your left knee back. Okay, and then I'm going to go ahead and assess the range of motion of your hips. So take your right hip and lift your leg up like this, and then extend it to the right, and then extend it to the left, and then back. You okay? And then in a circle, and then do it again with the left leg. So extend it up, and then back, and then to the left, and then to the right, and then in a circle. Okay, next I'm going to assess the range of motion of his spine. So I'm just going to have the patient bend down for me. And while he's down here, I'm going to assess his spine and palpate his spine. There's no signs of any scoliosis or deformities, no signs of any erythema. It is straight and intact. I'm going to have him stand up and then bend to the back to assess range of motion of his spine, and then go to the left and the right. Okay, next I'm going to go ahead and assess his gait. So go ahead and just walk to the window for me, and then walk back, and I'm going to assess his tandem. Do it heel to toe to the window, sir. And then I'm going to go ahead and assess his Romberg by having the patient stand still for me with his eyes closed, his hands and feet together. I would assess him for about 30 seconds for any signs of swaying or if he were to lose his balance. I'm going to have him open his eyes and hop on one leg and then hop on the other. Okay, thank you.